Now, the coronavirus pandemic has exposed gaping holes in Africa's healthcare system, and now the World Health Organization has warned about Africa, which is home to about 1.3 billion people, and this continent potentially could become the next epicenter of the pandemic. Now, according to the WHO, the pandemic could kill as many as about 190,000 people in Africa in just the very first year if it were not to be contained. Now, the study suggests that the pandemic could infect between 29 million to 44 million people in Africa. And these shocking projections are based on the assumption that no containment measures have been put in place. 47 countries in Africa currently have a total of more than 53,000 cases and more than 2,000 deaths. The infection wave has hit Africa later than most other nations, but the WHO believes that it could still translate into a prolonged year-long outbreak if it is not contained. But this isn't all. Another survey also shows that Africa is facing a surge in the number of cases with less than one intensive care bed and one ventilator for 100,000 people. Now, even in the best case scenario, the continent could need at least about 10 times the number if the outbreak were to peak. Now, Africa would need at least about 121,000 critical care beds continent-wide to deal with the pandemic, and not just the lack of beds, they are also unevenly distributed throughout the continent. Now, even in the best case scenario, about 12 patients could be lined up for one ICU bed during the pandemic. The continent's three most populous nations, Nigeria, Ethiopia and Egypt, have 1,920 intensive care beds between them for more than 400 million people. And not just ICU beds, ventilators are critical in the battle against the pandemic. The entire continent of Africa, has only about 9,300 ventilators. South Africa is said to have about 3,300 ventilators, but about two-thirds are in private hospitals, which most people just cannot afford. Some nations, such as Guinea-Bissau, have no ventilators at all in the entire nation. But even with the availability of equipment, the healthcare system in Africa is majorly understaffed. And according to World Bank data, one doctor tends to an average of 80,000 people in the continent. Only about 9 countries are said to have one or more physicians qualified to administer anesthetics per 100,000 of the population. Even though the number of cases are marginal right now, low levels of testing makes it almost impossible to know the true scale of the infection right now in Africa. Since the outbreak, Africa has carried out around 685 tests per million. This is in stark contrast to Europe's 23,000 tests per million, but even with a grim forecast, many African nations have moved quickly to contain the virus. Countries are launching high-profile public health campaigns, restricting movement and repurposing factories to produce protective equipment to tackle the pandemic.